Welcome back to Language Access Academy. I hope you had a good break. We are ready to jump right back in and conquer the second half of the letter P, and to cap it off, we will also cover our single lonely term for the letter Q at the very end. Are you ready? Let's get started. Pneumoconiosis is a respiratory disease caused by dust inhalation. Pneumocystis pneumonia is an opportunistic infection of the lungs caused by a single-celled parasite. A pneumonectomy is the surgical removal of a lung. Pneumonia is the inflammation of the lungs due to a bacterial or viral infection causing fever, shortness of breath, and coughing up phlegm. A pneumothorax is a condition in which air enters the space between the chest wall and the lungs, causing chest pain and shortness of breath. Poliomyelitis is an infectious disease caused by a virus. It usually causes mild symptoms, but in rare cases can attack the brain and spinal cord, causing paralysis or death. Polyarthritis is arthritis occurring in more than one joint. Polycystic kidney disease is a condition in which there are multiple, slow-growing cysts on both kidneys. Polycystic ovary syndrome is a hereditary disease characterized by multiple cysts on the ovaries, obesity, excessive hairiness, infertility, and irregular menstruation. Polycythemia is an increased amount of red blood cells in the blood. Polydactyly is the presence of an excessive number of fingers or toes. Polydipsia is the medical term for excessive thirst. Polymyalgia rheumatica is a rare disease of the elderly, characterized by muscle stiffness and pain in the hips, thighs, shoulders, and neck. Polymyositis is an autoimmune disease of connective tissue in which muscles weaken and become inflamed. A polyp is a growth that occurs on mucous membranes such as those in the nose and intestine. It bleeds easily and can become cancerous. A polysaccharide is a complex carbohydrate composed of 3 or more simple carbohydrate molecules joined together. Polyunsaturated fat is a fat or oil that contains well below the maximum number of hydrogen atoms possible, thought to reduce the risk of coronary heart disease. Polyuria is the excessive production of urine, which can be a symptom of various diseases, most notably diabetes mellitus. Porphyria is a group of genetic disorders in which substances called porphyrins build up in the blood, often causing rashes brought on by exposure to sunlight and reactions to certain drugs. Portal hypertension is increased blood pressure in the portal vein. The portal vein connects the stomach, intestines, and spleen to the liver. Positron emission tomography scanning, or PET scanning, is an imaging method in which substances emitting positrons are introduced into the body, and detectors connected to a computer form images of the tissues. Postcoital contraception is the prevention of pregnancy after sexual intercourse has occurred. Posterior describes something that is located in or relates to the back of the body. Postmenopausal bleeding is bleeding from the vagina that occurs after menopause. A post-mortem examination is the examination of a body after death to determine the cause of death. It is commonly called an autopsy. Postmyocardial infarction syndrome is a condition that occurs following a heart attack or heart surgery, characterized by fever, chest pain, pericarditis, and pleurisy. Postnatal describes something that occurs after birth, usually referring to the baby. Postpartum describes something that occurs after childbirth, usually referring to the mother. Post-traumatic stress disorder involves feelings of anxiety experienced after a frightening or stressful event, including recurring dreams, difficulty sleeping, and a feeling of isolation. Postural drainage is the drainage of mucus from specific areas of the lungs by placing the body in a specific position. Postural hypotension is unusually low blood pressure that occurs after suddenly standing or sitting up. Potassium is a mineral that plays an important role in the body, helping to maintain water balance, normal heart rhythm, nerve impulse conduction, and muscle contraction. When a condition is precancerous, it means cancer is likely to develop from it. Precordial movement is the movement of the heart that is seen and felt through the chest wall. Preeclampsia is a serious disorder that occurs in the second half of pregnancy, in which a woman experiences high blood pressure, fluid retention, nausea, and headaches. Premature labor is labor that begins before the full term of pregnancy, which is about 37 weeks. Premature rupture of membranes is the rupture of the sac that holds the fluid surrounding the fetus before the full term of about 37 weeks. Premedication refers to drugs, usually painkillers, taken 1 to 2 hours before surgery. Premenopausal describes the period of a few years in a woman's life just before menopause. Premenstrual syndrome, or PMS, involves the physical and emotional changes that occur in a woman 1 or 2 weeks before menstruation. Prenatal care is the medical care of a pregnant woman and the fetus. Prenatal diagnosis involves techniques used to diagnose abnormalities in a fetus. Prenatal testing includes tests performed on a pregnant woman or her fetus to prevent or diagnose abnormalities. Prepared childbirth is a technique in which a pregnant woman tries to minimize the use of pain relief medications during childbirth by learning relaxation techniques. The prepuce is another word for the foreskin. Presbycusis is the loss of hearing that occurs naturally with age. Presbyopia is the loss of the ability to focus the eyes on near objects that occurs naturally with age, as a result of the loss of elasticity of the lens. A pressure point is a specific point on the body where external pressure can be applied to prevent excessive arterial bleeding. A pressure sore is an ulcer on the skin that is a result of being bedridden, commonly called a bed sore. Priapism is a painful, persistent erection without sexual arousal, requiring emergency treatment. Prickly heat is a rash involving small, red, itchy spots and a prickly sensation that usually appears where sweat builds up. A primary disease is a disease that began in the affected location. A prion is an agent believed to cause several degenerative brain diseases. Procedentia is the severe prolapse of an organ. Proctalgia is pain in the rectum. Proctitis is inflammation of the rectum, causing soreness and sometimes mucus or pus in the stool. A proctoscopy is the examination of the rectum using a viewing instrument. A productive cough is a cough that brings up phlegm, which is the body's natural way of clearing blocked airways. Progeria is an extremely rare condition in which the body ages prematurely. Progesterone is a female sex hormone that plays many important roles in reproduction, including the thickening of the lining of the uterus during the menstrual cycle. A prognosis is a doctor's probable forecast of the effects and outcome of a disease. Progressive muscular atrophy is the gradual degeneration and weakening of muscles due to a degenerative spinal cord. Prolactin is a hormone released by the pituitary gland responsible for the development of breasts and milk production in females. A prolapse is the displacement of an organ from its normal position to a new one. Something that is prophylactic is used to prevent disease. Proprioception is the body's system for determining its position relative to the outside world. A prostatectomy is the partial or complete surgical removal of the prostate gland. The prostate gland is an organ located under the bladder that produces a large part of the semen. Prostatism refers to symptoms caused by an enlarged prostate gland, including difficulty with urination. Prostatitis is the inflammation of the prostate gland, usually due to a bacterial infection spread from the urethra. A prosthesis is an artificial replacement for a missing part of the body. Proteins are large molecules made up of amino acids that play many major roles in the body, including forming the basis of body structures and important chemicals like enzymes and hormones. Prothrombin time is the time it takes for a sample of blood to clot after substances that speed clotting time have been added. It is used to measure the effect of anticoagulants. A proton pump inhibitor is a drug used to treat peptic ulcers that reduces the amount of gastric acid produced. A proto-oncogene is a gene that is normally inactive but can become a cancer-causing oncogene if made active. A protozoan is a simple, single-celled organism. Proximal means located nearer to a central point of reference on the body, such as the trunk. Pruritus is the medical term for itching. Pseudogout is a form of arthritis with symptoms similar to gout that results from the depositing of calcium salts in a joint. Pseudomembranous enterocolitis is the severe inflammation of the colon as a result of antibiotic use by an immunocompromised individual. Psittacosis is a chlamydial infection resembling influenza that is spread to humans by the droppings of infected birds. Psoralins are drugs that contain chemicals derived from plants, used to treat skin disorders like psoriasis and vitiligo. Psoriasis is a skin disorder characterized by patches of thick, red skin, often covered by silvery scales. Psoriatic arthritis is a form of arthritis that develops as a complication of psoriasis. Psychogenic means resulting from psychological or emotional disorders. Psychological relates to the mind and the processes of the mind. Psychosis is a mental disorder in which a serious inability to think, perceive, and judge clearly causes a loss of touch with reality. Psychosomatic describes a physical condition that is influenced by psychological or emotional factors. Psychotherapy is the treatment of mental and emotional disorders using psychological methods such as counseling. Psychotic simply relates to psychosis, and a psychotropic drug is a drug that has a psychological effect. Ptosis is the drooping of the upper eyelid. Puberty is the period of time during which sexual development occurs, allowing reproduction to become possible. A pubic louse is a small insect that lives in pubic hair, feeds on blood, and is usually spread by sexual contact. They are popularly called crabs. A pudendal block is a local anesthesia procedure used during childbirth, causing the lower part of the vagina to be insensitive to pain. The pudendum refers to the external genitals, usually referring to the female. Puerperal sepsis is the infection of the female genital tract following childbirth, abortion, or miscarriage. The puerperium is the time period after childbirth during which a woman's body returns to its normal physical state. The pulmonary artery is the artery that supplies the lungs with blood from the heart. Pulmonary edema is the buildup of fluid in lung tissue, usually caused by heart failure. A pulmonary embolism is the blockage of the pulmonary artery by a floating mass in the blood. Pulmonary fibrosis is a condition in which the tissue of the lungs has become thick and scarred. The pulmonary heart valve stops blood pumped to the lungs from leaking back into the heart. Pulmonary hypertension is increased blood pressure in the arteries supplying blood to the lungs. Pulmonary insufficiency is a defect in the pulmonary heart valve in which it fails to close properly, allowing blood to leak back into the heart. And pulmonary stenosis is the obstruction of the flow of blood from the heart to the lungs. The pulp is the soft tissue inside of a tooth that contains blood vessels and nerves. A pulse is the expansion and contraction of a blood vessel due to the blood pumped through it. The pupil is the opening at the center of the iris in the eye that constricts and dilates in response to light. A purpuric rash involves areas of purple or reddish-brown spots on the skin caused by bleeding from underlying tissues. Pus is a thick, yellowish or greenish fluid that contains dead white blood cells, tissues, and bacteria. A pustule is a small blister containing pus. PUVA is a form of phototherapy that combines the use of psoralens and ultraviolet light to treat skin disorders. A pyelolithotomy is the surgical removal of a kidney stone. Pyelonephritis is the inflammation of the kidney, usually due to a bacterial infection. The pyloric sphincter is a circular muscle located at the junction of the stomach and small intestine that controls the passage of food. Pyloric stenosis is the narrowing of that outlet, and a pyloroplasty is the surgical widening of it. Pyrexia is a body temperature of above 98.6 degrees Fahrenheit in the mouth or 99.8 degrees Fahrenheit in the rectum. A pyrogen is any substance that causes a fever. Pyuria is the presence of white blood cells in the urine, usually an indication of a kidney or urinary tract infection. And finally, moving to the letter Q. The quadriceps muscle is the muscle, consisting of 4 distinct parts, located at the front of the thigh that straightens the leg.